Hi everybody, welcome back to my channel, My Life in Scrubs. I'm Stacy, I'm a registered nurse. I've been in healthcare for about 28 years. I'm currently a hospice nurse working on my bachelor's degree, and I aspire to one day be a nurse practitioner. But I thought today I could share what's in my bag. I've seen people sharing different times, and probably I'm late to this whole idea, but I know as nurses we have a lot of products that we carry with us. And people always say, why do you carry all that stuff? I have my nursing bag, my purse, and my lunch bag. And I think it's because we're away from our home for so long and we can't go back home to get the things we might need. So I think all of us nurses have an insane amount of products with us at work. So here is what is in my bag. In my pocket, I have two phones. I have my work phone and my personal phone. I always have a pen in my pocket, or 10. I carry a notebook with me in my bag and my tablet. So those are the things that are on my person at all times. And my bag is pretty cool. It has lots of pockets. In one pocket, I have gloves, hand sanitizer. In this pocket, I have disinfectant wipes to clean my supplies. I have N95 masks, isolation equipment, a few extra bandages, some swabs that double as measurement guides sometimes when I'm doing wound care. And I also have a box in my car. My car is essentially my office in hospice. All the supplies that I need for my patients, extra wound care supplies, personal care items that they might need in a pinch. I have all those boxes in my car as well, and I have files in my car and extra charts. So that's something you don't see in my bag. But inside my main compartment, I have this nifty little box, and I can't take credit for this idea because I trained with a hospice nurse who she's a veteran, and she had one of these boxes for all of her supplies, her vitals equipment. And I thought, wow, that's really nifty, because if I can't take my bag into a home, and sometimes that's possible, I can just carry this and disinfect it. So inside this box, I have my thermometer, bandage scissors, pulse oximeter. I have a tape measure, and I have a wrist cuff in this box. Now, I do test my wrist cuff against my other cuff to make sure that it's reading pretty accurately, and if it gets funky readings, I do a manual. But I will tell you that when you have somebody with dementia, a wrist cuff is better than an arm cuff, because they never, ever like you squeezing their arm. I have been a nurse a long time, and most of them don't want you to squeeze their arms, so there's that. I have my stethoscope in here. I have an electric arm cuff, and inside this bag I have two regular sphygmomanometers, the standard blood pressure cuffs. So that's what's in my main compartment. And I use all of that stuff routinely. Something that I didn't say that I had in this bag also, when you are a hospice nurse and you're going into people's homes, you also need to lay down a barrier to protect things. So there are barriers in this pocket as well. This is my paper pocket. I'm not going to pull stuff out of here, but I generally have a notebook in here. Something valuable that I have that was given to me in my startup kit and that we give to some of our patients are some books that we give to our patients. The 11th Hour, a caring guide for the hours to minutes before death, and this book. When I first trained as a hospice nurse, the gentleman who trained me was magnificent, and he gave me one of these books. It's gone from my site, and it walks people through the process of dying and symptoms to expect, and it's just a really wonderful book, and it's an easy read. So it is something that I share with my patients sometimes. And of course, I have more pockets. So in this pocket, I have my guide to, it tells me, what I should be charting on. It's my Bible. I have this as my Bible. I have 2 versions of this from different companies that I worked for. And I have this bag, which is really cool. And it's got all sorts of pens and chapsticks and skin prep and things like that that you might need. I don't know why I thought I could talk about this longer, because there's not much to talk about when you start showing what's in a bag. But as a hospice nurse, you are working in your car, so you need an extensive amount of things to do what you need to do, and you have to be prepared for things that might come up in your day. Such as wounds that might develop, because when people are compromised, their skin sometimes begins to break down despite all the measures that you can take. Sometimes you just can't prevent those things from happening, and so you need wound care supplies. And of course, as we get older, our skin gets fragile and we bump into things and tear our skin. And I'm pretty clumsy, so I really feel sorry for whatever nurse has me when I get there, because I already bump myself all the time. So I know when I get to that stage where I need a nurse to look after me, she's going to be frustrated with all the skin tears I'll probably get. The other thing is, in a home setting, they do have charts. Generally, everything is done electronically in my tablet, but there is a paper copy in a chart in people's homes. And it has their plan of care, it has instructions for the CNA, it has a med list for the family, and it's things that need to stay updated. And just like when you're working in long-term care, there are people who will survey you and follow behind you to make sure you're doing what you're supposed to be doing, and they want to see that in the patient's home as well. So I have lots of papers in my car, and I have a clean and dirty area in my car. To help. I never take anything dirty into my car. I think the last thing that I took in there was some footies that I wore into a house and had to take them off outside of the home, and I couldn't find a trash can. And so I did utilize the trash in my car, but generally I don't carry soiled items out of the patient's home. I do have a sharps container in my car too that I can take into the patient's home. But generally, if a patient is utilizing sharps, I would leave that sharps container in their home. And standardly, I'm not doing medication administration in this position, although I'm doing a lot of med setup, and I do sometimes administer meds, but it's very, very few and far between that I've done injections in the home setting. Mostly it's oral medications, and I have managed IVs in the home setting, but again, there's usually a sharps box in the home when that is has arisen. Something else I carry in my car and sometimes in my bag is coffee grounds or kitty litter, because when a person does pass, we are responsible to dispose of those medications. So a lot of times new nurses who are new to hospice will say, "What do you do?" Or the families will ask, "How do we get rid of these?" Years ago when I started as a nurse, we flushed everything down the toilet. We did. We took all of those pills, popped them into a cup, and flushed them down the toilet with 2 nurses. And now you don't flush things down the toilet. Now things get returned to the pharmacy to be incinerated, and there's a process. There's like a box that things get put into in long-term care. But in the home setting, when you're helping families dispose of their meds, they can either take them to a local pharmacy like a Walgreens to dispose of meds, or you can help them dispose of them in the home with kitty litter, coffee grounds, dish soap, all kinds of things to toss them in the trash, essentially. But it's best to just get rid of those things at the end of everything. And most times families do want to have those things not just laying around in their house. So I do also additionally carry kitty litter or coffee grounds in my bag, and I have at times had to ask family members if they have any old coffee grounds from their coffee this morning or something that I could use. Another thing that I carry in my car is I have this really cool little desk that hooks onto my steering wheel, and it's really nice when I need to do charting or something, because I can actually set this up like a little tablet and do charting in my car if I need to. Generally, I don't have any charting to do in my car. I generally, in the program that I'm using, am charting in the home. So it's not something I really need. Plus, we eat lunch in our cars a lot. I spend a lot of time in my car. I probably see about 5 or 6 patients a day max. I've had days that are a little lighter, but I'm generally eating in my car. So again, I have all these bags. I have a lunch bag, my purse, and my nurse bag in my car, all. So I also have this desk in my car that hooks onto my steering wheel. But let's be honest. I don't always get that desk out anymore, but it's a wonderful tool to have, and I might show it sometime if you're a home health or hospice nurse and you're watching, because it's really handy to have, and it helps you to utilize your laptop or tablet if you need to chart inside your car, because there are times when it's not possible for you to chart inside the home. There's nowhere to sit and chart sometimes, or there's a lot of family members present, and there's just, you sometimes need to go to your car and finish your documentation. So it is nice to have those items, and they do sell stuff like that on Amazon pretty cheap, pretty reasonable. And trying to think if there's anything else handy that I have in my bag sometimes that I'm not showing you today. Sometimes I have snacks in my bag. Not so much in this position where I am now, but when I worked at my last job, I did admissions, and sometimes it just wasn't convenient to take my lunch bag into a hospital setting with me. And there were days when I was in the hospital for many, many hours, and so I would keep a granola bar or two in my front pocket where I keep my personal stuff. I have hand lotion in there, and it's always important to use a good moisturizer when you're a nurse, because you wash your hands a lot and they get sore, especially in the winter time. And there's extra batteries in here, because we know that electrical devices stop working and we end up needing to change the batteries. Also, my glasses case is often in my bag, because I have sunglasses that I can switch to when I'm driving, and it's more convenient to reach into my bag and get that out than anything. Just trying to see if there was anything else interesting in here that might tell you about me. Look, this bag needs to be cleaned, but I think I have a container for everything in here. Oh, I have measuring guides in here too. For wound care. And I also keep my masks, like a regular mask, in here in this bag. My N95s are in a different bag, but I have regular masks that I keep in a bag separate. Like, everything is in its own little compartment in here. I carry oral syringes, because sometimes you have to help families set up medication doses, especially when you have elderly folks that can't be drawing up their own medications, liquid medications. I don't carry medicines in my bag. I don't carry medicines in my car. And that is something that I have always reiterated to patients and families. Hospice nurses do not have medication in their car or on their person. We just don't. The medicines that we order come from a pharmacy generally to the patient directly. Hospice nurses do not carry medicines in our car, unless it's like triple antibiotic ointment or wound care. I do sometimes have Medi-Honey in my car, but as far as like medication, pills, anything like that, hospice nurses aren't carrying that. I probably have some ibuprofen in my bag for myself. I guess I thought it would be more interesting than it was, because everybody is always asking me what is in there because it's so stinking heavy. My life is in here. This is my office. And so patients will often ask, family members will often ask, what is in my bag? So I just thought I would share that because it's a lot of useful stuff. There's also a guide in here that helps me to do teaching for pain medications, which I won't show because it has my company's name on it. But I have a lot of really nifty tools in my bag and on my tablet. Also, I do carry a notebook to write in because I am older and I started in nursing a long time ago, and I'm not going to put that in my phone and remember it. I'm going to write it down. This is my brain, really. If I need to remember to do something, it's definitely in here. As far as like remembering important dates and things like that, I have learned to utilize the calendar a lot when it comes to being a nurse now. But as far as like notes that I need to jot down later or things that I need to take care of, this is my brain, and it's been my brain throughout my nursing career. I've always had a notebook. When that notebook fills up, I do dispose of it in a shredder. I don't keep my notes forever. But I don't think anybody would really understand what my notes say anyway. It's a bunch of chicken scratch that only I can read. And of course, when I took nursing, we charted on paper, and we used abbreviations that we don't use anymore, really. I think we generally, in electronic records, have a tendency to chart things as they are. And also in a home setting where you are giving someone a copy of their record, you do want them to be able to understand those instructions in layman's terms. So part of being a nurse in a home setting is learning how to communicate with people in terms that they understand. And those abbreviations would do no one any good in the home setting unless they had a medical background. So my notebook is still written in nursing shorthand and abbreviations because that's pretty fast for me. So I do speak that language, and I think most of us do. But generally in charting, they do ask us not to talk in those abbreviations anymore, just for continuity and so that everybody can understand. But again, in my setting, I'm dealing with people in their homes that don't necessarily have a medical background. So they do need to understand what the instructions on their medications say in terms that they do understand. Sometimes I've caught myself over the years using words that I think a lot of people have, when they get to a stage where they're on hospice, they've experienced a lot of medical appointments and medical jargon. But I think generally speaking, it's important to understand how to communicate with people beyond medical jargon and speak to them in terms that I just think that when you're talking to somebody, you need to be able to communicate effectively together. And I know when medical professionals use those terms with me, I do understand them because I'm a nurse. But there are times when I have felt like if a person is talking to me in a certain manner, it almost comes across as condescending, and I never want to do that as a nurse. So I guess I don't need this bag anymore on my lap, but it's kind of a security. I take it with me everywhere I go. This bag has been with me since I started this job. And I was looking at it today, and when I decided I was going to share what was in my bag, I realized I need a new one. So If you have any questions or you want to see something or know something about what I do, I'd be happy to answer them. You can put them in the comments. I thank you for watching and returning, and I thank you for your time. And if you would like to see more of me and my quirkiness and my chaos, then please feel free to like and subscribe and follow. And I hope to see you soon. Thanks for coming.